Thank you for that introduction, and it's great to see everyone here. I talked about this concept last AED meeting in June of 2021, and there was a much smaller audience, so I'm happy to talk about this here. Also, if you're wondering who is that person that brings their children to a medical meeting, apparently it's me. So, so I'm here representing Nile. Let's see, how do I for this?
Sounds like an Egyptian company.
We've been around for about 1.5 years now, and I'll just give you, since many of you weren't here last or weren't at the meeting last summer, I'll talk a little bit about our genesis and then what we've done in the past year. We're essentially a care management platform that aims to reduce the inefficiencies that we all know and recognize occur for patients with epilepsy. This starts beginning with med titration and the interminable delays that many patients face in terms of getting through successful titrations to eventually reach a medication that either works or determine that they're going to have a drug-resistant form of epilepsy. So we first launched in January of 2021 with our care management platform, which we had developed essentially remotely during the pandemic. We successfully in 2021 ended with installs in 6 hospitals. I think we now have several hundred patients that are managed through those hospitals using the care management platform. And we also have about 5,000 patients that have used the app in the wild. And I'll go through just briefly what we deem to be the optimal way that this application is used, which is in partnership with a healthcare provider. We have partnerships with the Epilepsy Foundation. In fact, we migrated over 400 users of the prior My Seizure Diary over to our platform successfully last year, which we're very pleased to do. And now I'll talk a little bit about our future visions for how we can help more patients get to an optimal treatment more efficiently. This looks like a mobile app. I know Bob and I both have a long history with various seizure diaries. And so I think it's important to say right up front that, the core feature for patients is going to be a mobile app experience. And this allows patients to do all of the normal requisite things, which include logging seizures, side effects, med intake, and whatnot. But this actually isn't what I view as being kind of the core functionality of what we're trying to build. And that lies in the partnership with the healthcare system and with the provider. So when I first became involved with the company and I knew that there were plans to develop a mobile app, I said, hey, this has already been done 10, 15 years ago. And unless we put something unique in it, it's not going to be successful. So I won't go into all the gory details of what's in the app, but one of the cornerstones is really medication titration. So I think everybody in this room understands that the whole notion of a titration is a relatively foreign concept to many patients. Patients get very confused. In my personal experience, patients will come back after, say, a 4 or 6 week period, and they'll have either never even started the titration because they never received the medication, or they arrested halfway through, either because they didn't understand the next step or they were experiencing side effects and didn't know what to do. So our experience really starts in that clinical visit when a nurse or a physician enters a titration schedule. And then the patient, when they go home, they open the app and it basically says, here's what your physician has prescribed to you. Please engage with the app whenever you have the meds. So the very first question the app asks is, do you have the medications? It's such a simple thing. And yet when I'm writing out a schedule for a patient, I don't know when they're going to get their meds. Some of them get it the same day at the clinic. Some of them don't get it for another week. Some of them don't get it for 2 weeks, depending on whether they go to a brick and mortar pharmacy or they do mail order. So the app asks, do you have the meds? And when they hit yes, then it auto-populates an entire calendar for them to use. And on each day that they need to switch the meds, either increase the dose or go to twice-a-day dosing, it tells them how to do that. It also asks them on those days whether they're ready to move. And if they're not, then it says, hey, we've detected a problem, you need to call your doctor. And that could be because they don't understand what a titration is, or it might be because they have a side effect that they're reporting. And so that's the real power. So, we have 5,000 patients in the wild, but not all of those patients are connected with the doctor. We hope that still has utility for those patients, but the optimum usage of the platform is fostering that connection and enabling a communication bridge. We've gotten a lot of experience with this over the past year. Again, our goal is to really take this very protracted journey, which really starts with medication trials and ends for some patients, too few patients, with being evaluated in a comprehensive epilepsy center, and then basically shrinking that entire frame down. So we start with the titrations. Our aim is that we can get people through medications much more quickly to determine which medication is going to work for them, and if a medication isn't going to work for them, to make that determination. And then the next step is identifying those people through the app and sending them to comprehensive epilepsy centers, which I've said for a couple of years now should be a completely uncontroversial proposition, I would hope. You might be surprised, but anyway, that's our aim. So how did 2021 go for us? Well, our goal was to be in 5 hospitals. We ended up being in 6. However, I would be misleading you if I said that everything went exactly as we had hoped. The entire contracting process for working with hospitals was very long, frankly. And when we began to explore the business, propositions for making this a viable model over the long term, it became relatively daunting appearing, which I'm sure doesn't surprise anybody who's been working with epilepsy diaries for the past 10 to 15 years. So
Or with hospital administrations.
Yeah. Yeah. The theory is all there, but the reality, yeah. So we've been exploring in the past few months, I would say, a companion approach, and that is going to patients directly. Effectively in the software world, which I've now become very immersed, eating our own dog food, so to speak, right? So using our care management platform to engage with patients who currently have no access directly. And this isn't a rocket science idea. This is a trend that's occurring all throughout healthcare, in some ways good, in some ways not so good. But there's a variety of kind of specialty virtual neurology practices that are being spun out. So we're in a beta phase right now, only in California. We know through our data science mining that there are thousands of patients in relatively resource poor areas. So this map basically is a pictorial demonstration of where there are the disconnect between numbers of patients and either a paucity of epileptologists or an overabundance of epileptologists. So we know in California alone, there are thousands of patients who most likely have a diagnosis of epilepsy. We can determine that through claims data that's been well validated in the literature. And yet they've only seen a PCP or an ER doc. They've never even seen a neurologist, let alone an epileptologist. So, we think that if we can find those individuals, reach out to them, establish a relationship virtually, get them onto the care management platform so that we can quickly determine if they're still having seizures, even after trying, 2 or 3 medications, that we can then act as a conduit to get them to the comprehensive epilepsy centers where they need to be. So that's what we're doing now. It's in beta, only in California. We're learning as we go, and I've already talked to a few people to kind of talk about a lot of the early lessons in terms of what is effectively starting a new clinic in a purely virtual space. But that's our aim presently, and I think our mission hasn't really changed. But I do think we have to look at these other approaches to try to make this a long-term viable strategy. So I think that's my last slide. I'm happy to take any questions.